Oh, yeah.
Otherwise, I wouldn't have had it.
This is Juan Doses, and welcome to another episode of Scumbags. Today we're interviewing my mother because she got the jab. So we're going to ask a few questions about how'd they make you take it, and what happened to you.
All right.
So how did they make you? What happened to you? Why did you take the stab?
They told me that, along with every employee at Palomar College, that if we didn't have the jab, that we would be terminated. They sent out emails in writing. Termination.
Who told you that?
The administration at Palomar College.
Okay, so when you got vaccinated the first time, what happened?
I had already had COVID twice, and I was still recovering from COVID, and the administration said, well, you have to have the jab, and I said, but I'm sick. I didn't know what was wrong with me, and they go, yeah, but it's been 90 days past COVID. We want you to have the jab, or we're going to terminate you. So I went and had the jab.
Who administered it? Where'd you get it?
I went and got it from one of the local outfits in Escondido, where you go in and, they had all these people in
Which
tents.
one did you get, the Pfizer?
Yeah, I got the Pfizer vaccine, and at that point in time, they required it to be 2 weeks apart.
Okay. So when you went there and got the jab, did you notice who are the people? Did you notice anything there? I mean, were they military? Were they police? Were they?
No, they were essential health workers. Clearly, people that were like people that worked in nursing fields and in doctors' offices, and they kind of had it down to a quick routine, and it was at a local church. So I walked in, they administered it.
What happened to you when you got it? What did it do to you?
Okay, the first jab in my left arm, your lymph system is different in your right or left.
Just tell us what we did. What happened to you?
So the first jab I got May the 9th, and immediately it made me way sicker than what I was. I was in bed like I had a really bad case of the flu for about 5 days. And the second jab was 2 weeks later. The second jab, same left arm, and same church, same manner. They give you the shot, and then you sit down for 15 minutes because they wanted to keep an eye on you to be sure that you didn't pass out or anything. Then you were allowed to leave. I went home, and I started developing pain on the left side of my body in my torso region and left arm. And at first I thought I was having a heart attack, but I finally decided I wasn't, because it's the right arm. And then the pain it started underneath my left rib cage in my left torso, and it got larger and larger till it was encompassing my entire left torso from my clavicle all the way down to my hip. And it literally felt like that there was something that was going to explode inside of me. And I was working from home, working remotely, so it wasn't necessary to have the vaccine. The college didn't even open.
So what happened to you beside the pain?
I couldn't think straight. I was having sweats.
And how long did this take to happen once you got the shot?
Oh, it started almost immediately. But I didn't think it was the shot. I didn't connect the dots.
So then what happened? When did you start noticing when did the most severe symptoms start? What were they?
Well, the issue of the pain on my left side of my body started almost immediately, and then it just got more and more intense till it was covering. It felt like that there was underneath my left rib cage, as though that there was something that was like pressure.
Mm-hmm.
It was like sharp pain, and then it spread out to where it was covering my entire left rib cage from my front breastbone all the way to my back spine. Pain.
So then what else happened outside of the pain? What were the other things that started to happen?
I developed some really odd neurological conditions. My left eye started getting, out of the blue, suddenly it felt like somebody was stabbing me with a needle in my left eye, but there was no There was nothing in my eye.
Then okay. So what else? So did you say you started swelling up? Is that another thing that happened?
I felt like my left. I felt like something underneath my left rib cage was swelling. That's how the pressure was so intense and painful. And
Did anything visibly?
No, that's what's really weird. Is there was no sign of any rash. There was no redness. There was no redness in my eye. There was no rash or redness
So
in
what
my
made
chest.
you decide to go to the doctor?
I didn't go to the doctor. I went to the emergency room.
Okay, so what made you go to the ER?
Very early in the morning on September the 14th, I thought, I'm dying. I've never dealt with. It was a sick soreness, and it was now encompassing like the entire left side of my torso, and my left eye was like every couple hours it would get stabbing pain in it. And then I took a flashlight and I looked through my left eye. I shined a light through my left eye, and you could see something inside of my eyeball.
What could you see?
Like like a mass that was opaque in there. And so I quickly looked up on the internet, and it said that tumors sometimes develop in the eye based on past viral injury. And then I remembered when I was 38, I had shingles, and all these symptoms that were happening to me were on the left side of my body, and I was beginning to feel that maybe I was this.
So when you went to the doctors, what did they tell you happened?
When I went to the hospital, they took me in right away. There was nobody else in there, so they had a lot of staff to work on me. They checked me for cardiac infarction, which I didn't have. They checked me for a pancreatic infarction. Apparently,
So what are they saying that happened?
After they went through multiple tests, they finally said that they felt that I had a COVID sequelae, which meant that I had had so much inflammation develop that I had burst forth with tumors, multiple tumors. My CT scans showed tumor in my left eye.
So when they took scans of you, that's when they saw these tumors had erupted throughout your body?
Yes, on the left side.
So I'm asking you these questions. I'm just trying to stay focused on the questions,
right,
because I don't want this to look like I'm leading you.
Right.
So I'm just asking straight questions. So once they figured out that all this happened, what was their prognosis? What are they saying to you now?
Back then, when it was happening in September and October, their next step was they wanted to line me up to do biopsies of some of the tumors, and they did a surgery in late October to remove the tumor from my left eye, and it was indeed exactly what I thought it was, a Saltzman's tumor. It was benign.
So
the tumors.
How are the doctors treating you? Are they listening to you? Are they treating you well?
They were nice to me, but there was no procedure for treating COVID outside of hospitals. They had nothing set up. So if you were hospitalized...
Were you ever set in isolation or quarantine as a result of COVID?
Yes.
So, have you tested positive for COVID
Yes.
since you've been vaccinated?
Yes.
Okay, so what would you tell the world out there as far as getting the jab?
Getting the jab does not in any way, shape, or form guarantee that you will not get COVID again. It does not.
Would you recommend anybody ever get it at all?
No, because...
No.
No.
Not after what happened to you.
Yeah, because you shouldn't have people... Everybody should be looked at... Everybody should individually...
But I just want to ask you a question.
Sure.
Do you realize that when they coerced you, that you could have walked away?
No, I felt totally, ultimately threatened and harassed. They were also calling me a racist at the time. They also disciplined me for
But if you could go back in time, would you not have simply told them to shove off and not taken the jab? Is there anything that you could have changed? Would you have simply been willing to walk away, regardless of what they call you?
Well, now,
If you could go back in time.
yes, I would say don't do it. And I tell everybody don't do it.
So that's what I'm trying to tell people, because because people are saying I have to work, and I say you can always find another job. But you can't
Your life isn't worth it. And now I've been permanently
find another life. So coming from someone who's been coerced
Yes.
for the sake of your employment, what would you tell people now?
I tell them scream from the highest trees and say, and don't do it.
No matter what.
No matter what.
Thank you. That's what I'm trying to make clear to people. So even if you have to live in a rock,
Yep.
even if you have to walk away from your job and
Yep.
live in a cardboard box and be homeless, and everybody makes fun of you for not getting the stab, would you still stick by your guns and say no?
Correct.
Especially seeing what you're going through now.
Yes, now I'm receiving radiation treatment for cancer. And the patent holder for the mRNA vaccine himself, who is the same age as me, who also had
What's his name, Jeff Orla?
No, his name is Dr. Robert Malone, and he had his vaccine almost within 3 weeks of me having mine. He also nearly died from the vaccine, and he himself led the march against having the feds lift. He wanted the mandate lifted.
So, okay, does this give you any thought about people telling you what to do with these kinds of things with regards to...
Yeah, I don't trust my government. I don't trust the healthcare system because I don't think they're the least bit interested in the healthcare of the people. I think they were only interested in power and control and selling as many vaccines as they could.
What kind of pain are you dealing with now on a scale of 1 to 10?
Chronic pain right now. I have inflammation that's chronic. It's probably a 7 or an 8. And some days I can hardly get out of bed.
So, I appreciate your time. And I just want to, for the sake of our format, remain brief. And just, again, is there anything with regards to your experience, to just plain words, for the sake of simplicity, just in plain words, is there anything about this whole experience that you'd like to tell people?
Yeah, I've lost all trust in the supposed government authorities. I have absolutely lost all trust.
Do you believe anything that anybody tells you anymore?
No, as a matter of fact, even the doctors have secretly gone off the record and said to me on the side that they do not feel free that they can give me the treatment they want to give me because they're being forced themselves.
I'm very sorry this happened to you, Mama. And this fills me with sadness and shame and rage that I wasn't there.
You
should have been.
You couldn't have stopped it. You couldn't have stopped it. Remember,
But this is. I hope I just want people to understand why I'm half cocked, because I know these things. I know who did it, why they did it, and we're not going to get into that at this moment. So, again, thanks for your time, Mother. So this whole thing is struck very close to home for me. I do take it all very personally, and think for yourselves, folks.
Yeah, the information is out there. The information is out there, folks. There's plenty of data now available showing that this should never have been done like this.
None of it should have ever.
Never. And they're finally just now coming out with the information.
All right. This is Juan Doses, and thank you for sitting through another episode of Scumbags, and thank you, Mama.
You're welcome, Surgeon. I love you very much.
I love you too.
Thank you for letting me speak on your show.
Again, I'm just telling you why I'm so half-cocked, and it's hard for me to know these things and know who they are and what they've done and not be angry. Love you.
Love you.
Bye-bye, Mama.
Bye.